In the next 20 minutes, I would like to share with you some information regarding heart failure in China. So I'm going to present in the four aspects. First, I would like to show you the burden of the heart failure, and also the second, I will show the underlying reason what coexist in the heart disease, and also the changing over time. The third is a static treatment. And finally, I would like to share with you some of the recent case fatality rate and also some associated risk factor with heart failure in hospitalized heart failure patient in China. If you compare with other heart disease or cardiovascular disease, heart failure is a little under-recognized by the research in China. So only population survey we can find actually published in over 10 years ago. It's a survey among the population age 35 to 74, and this survey actually is a record of the community population. I don't know how they diagnose. I believe it's diagnosed heart failure is according to the symptoms and history. So according to this study, the prevalence rate in men is 0.7% and in women is 1%. Now you can see the prevalence rate of heart failure in Chinese general population increase with age as expected. And women have a higher prevalence rate compared with the men. And also in China, we have a very big population over different part of the regions, north, south, and west and east. It's very different lifestyle even. So you see the north part, the China have a higher, even double the prevalence rate, heart failure compared with the south region. But in the north region, we have more hypertension and more heart disease too. The urban have a higher prevalence rate compared with rural population. In both the region difference and the urban and rural, we see the female women have a higher prevalence rate heart failure, the chronic heart failure. Now we don't have a update data. Then I go over Ministry of Health, the website. I find that when they provide actually hospitalized data very clear, but no heart failure. They put heart failure combined with a different disease. Then when you see the CDC website, they don't have heart failure independently calculate the mortality rate. So I think that is a situation maybe other countries also have this situation. The heart failure did not recognized by the public health, the policy maker. But expect, this World Bank expect in China as the population aging, the people with the chronic disease will increase a lot. So the population aging, we can expect the number of the patients with heart failure will increase. And also according to I think this bout is most update is published in 2011. Then they expect in next 20 years the number of age AMI and the number of stroke patient. You can see the expected number of patients with the AMI and the survival will increase a lot. So those will be because the CHD become more and more the patient with the reason for the heart failure. So I think the number of heart failure will increase as expected. So what is about the characteristic heart failure patient, and also what is the coexisting heart disease or underlying the causes for them? Then there is several big the registration study in China. Investigation is over 16,681 heart failure patients hospitalized during 2010 among 8 cities, 12 large hospitals in China. It's showing even the follow-up of those patients for is average of 5.82 years. So I think that is a very big one. But the region is limited in the south part of China, not north. If you see the data they published in 2 years ago, the reason, the underlying causes for heart failure will coexist in heart disease are very different between men and women. In men, dilated cardiomyopathy will take account is almost 30%. The CHD is number 1. So, do I have a pointer?
Yeah.
Oh, okay. So you can see the CHD is number 1. Then DCM or number 2. Then the hypertension, that is a major reason. I believe there is others, but they didn't show the data in this publication. The rheumatic heart disease only 8%, 3 among men, but for women, there's 23%. The reason for heart failure is from rheumatic heart disease, but much less women with the DCM. This number is almost very close to the men. But as the age increase, the reason for the heart failure are very different. You can see for the young people, most of them, the hospitalized is for DCM, and very few of them for CHD as expected, and for hypertension. And the rheumatic heart disease decrease as the aging the population, with the increase to the age group 70. So most patient with the age over 70, the reason they hospitalized for the heart failure will coexist with this is coronary heart disease. Just men. And almost the same situation in women. I believe I have another slide for women, but okay. And another study is one hospital study that shows over almost 7,000 patients heart failure hospitalized from 1993 to 2007. You see the CHD is number 1. Then they put valve heart disease as a very high percentage. So the report are different, but I think this one is show that diabetes is one very important. It's a different with the one from a very big one. So, and another national study with 42 hospitals and over 10,000 heart failure patient information. This study organized by the Chinese Society of Cardiology. They published almost 10 years ago. It's showing among those 42 hospitals nationwide, they compared the changing pattern from 1980 to 2000. It's the number of heart failure patients. Number of hospital, the age decrease, so the mean age decrease, so the heart failure patient is younger, and also the patient, the duration for the heart failure is shorter. So 70% in 2000 is the heart failure patient diagnosed less than 5 years, but in 1980, many of them is a long history patient, and also you see the duration hospital stay decrease from 35 days to 21.8 days, still very long day. So the cardiology, they don't want to see the heart failure patient in the ward because they have they should have some indicator, the quality. They cannot have very long stay patient. So I think the heart failure really is the one occupied a long time for hospitalization. The next study is it's organized by the Chinese Society of Cardiology, showing the different reasons. They include the valve heart disease, the rheumatic heart disease origin, lung, and the DCM, coronary heart disease. I put ischemic heart disease to compare with the congenital heart disease, hypertension, and others. Still, you can see that actually coronary heart disease is the one that's very important one. And also, the study show the performance. In 1980, there is 85%, 58% that report heart-chest ratio. Then they show is 34% the people have the abnormal one. But to the 2000, the number is almost the same. But the number of hospitalized patients report left ventricular EF is evaluation for the left ventricular function will increase in this 20 years. There is because from 2000, the recent 20 years, there is a big increase clinical evidence, and also evidence-based medicine become very popular. There, if you see the paper published in 2010 in 1990s, there is only 100 guideline published. You can search by the PubMed. But in 2010, there's over 1,000 guidelines. So guidelines become more and more the guiding for the clinical practice, and based on the updated clinical evidence. Then even in China, we have very few RCTs based on Chinese population. But also there is here 7 guideline or it's like guidelines based on evidence, whatever the were available. So I mean that there is many clinical guideline for the clinician. So what about the treatment statute? It's another, the third aspect, the treatment statute in China. Actually, I'm not expert in heart failure. I'm only the epidemiologist for cardiovascular disease. But you can see the percentage. If you only see the percentage, maybe it's not comparable with others, but still you see diuretic is number 1. Over 30% patient among the heart failure they use diuretic. Still, many of use digitalis. Then this study, I previously showed the data. You can see the changing over time. The percentage, then the diuretic decrease, actually ACEI increase. Beta blocker increase, but still very low. Dialysis is decreased too. There is a little increase ARB, but I believe the data were updated is increased a lot here. And also, you see the difference, the practice pattern over time. This year, a paper published in Lancet, the summary is very big sample size registration to show the practice pattern change over time in China for the AMI. I think that because AMI, more and more coronary heart disease because the underlying causes for the heart failure. So the practice pattern and the treatment schedule may indirectly reflect the treatment in the heart failure. I'm sorry for the very small, but see this more recent, they summary the data from 2001. This is 2011, very recent data. I have some. Yes, this is a beta blocker. It's almost the same. I think there is very similar. Also, they show you the different. There is 50% the patient they use a beta blocker, and the number of patients who use ACEI were little increased. The most significant increase among those patients hospitalized for ACS is starting increase. You can find is from a 29% increase to 92%. So I believe there is evidence is very strong behind the starting. But the problem in China is after patient discharged. This study published on the heart in 2000 showed that they follow up those patients in collaboration with Australia George Institute. It's also the registration study showing that after the 6 months and 3 months or 6 months follow up, all the treatment drop. And if you see the survey in the primary care setting, you see the very low percentage of people with heart failure use ACEI beta blocker. But in currently, many patients they use digitalis compared with very low ACEI with strong evidence. So I think this pattern is showing in China real situation when the patient discharged. Sometimes they stop everything, but sometimes they change the primary doctor to know what they should do or how to deal with those patients. And the paper published in Lancet 2 years ago by the Selim Yusuf is a very big study, pure study. You may know that study. Also show if you go to the community, find the CHD patient, then you find a very, very low percentage different parts, especially the developing country, China, the starting use is only 2%. Very low for beta blocker. And this is not for the heart failure patient, but I think it's indirect reflect the situation, the treatment for the secondary prevention include heart failure. So what is the case fatality rate when the heart failure people hospitalized? over time, I think the medical care level increased a lot. So the case fatality decreased from 15.4% in 1980 to the 6.2% in 2000. And a study showing the many comorbidities among the heart failure hospitalized patient in different age. As the age increase, I think we can expect the increase the comorbidity, the number of comorbidity disease increase, and it shows really for the patient they hospitalized with more comorbidity disease, very high case fatality rate, very poor survival rate, and it's one my student, we did a study, is a nationwide study, is also not for heart failure, it's a secondary prevention for CHD. So we published a paper 2 years ago, International Journal of Cardiology, to show how the heart failure impact on the in-hospital outcome for the acute coronary syndrome patient. This study is a nationwide study. Then this comparison, the baseline comparison for the patient, no heart failure, the heart failure without acute heart failure during hospitalization, and also the patient have acute heart failure during the hospitalization. Then if you compare the mortality rate, that means the case fatality during hospitalized, it's very high case fatality rate among those with acute heart failure. I don't know this number is comparable with other or higher than others, but I think it's very high. It's very high. So this lungs hospital stay for the people, if they don't have a heart failure, this average day is almost 10 days. I know it's a little bit longer than the Western country in China. 11.3 for heart failure, 13 days for the patient with acute heart failure during the hospitalization. And the in-hospital outcome is also the big difference between the patient they don't have a heart failure, the heart failure with acute heart failure and acute heart failure. This is analysis the multiple variable, which one the variable is associated in-hospital mortality rate. You see if you have a acute heart failure, I think that's expected. The aging, the male, and also diabetes, non-STEMI and the STEMI compared with unstable angina can increase the risk for the hospital deaths, and the starting use beta blocker, aspirin use, and PCI can reduce that. So in summary, the disease burden of heart failure increased because population aging and the increased epidemic coronary heart disease in Chinese population. I think that is the two reasons we can expect the number of heart failure increase. Include the hypertension, the increased hypertension. There is a remarkable change in the pattern of management of heart failure, especially chronic heart in clinical practice since 1980s. A considerable gap exists between guideline heart failure and the practice in China. Thank you very much.